We started these mighty conversations 2 decades ago, and there's no time like the present to talk about the things that are important. I'm Commissioner Khadijah, and this is the Mighty Six Conversations. Welcome to another edition of Mighty Six Conversations. I'm Commissioner Khadijah Abdul-Rahman, affectionately known as Commissioner Khadijah. December is HIV/AIDS Awareness Month, a time dedicated to increasing public awareness of the HIV/AIDS epidemic. We're committed to promoting awareness, prevention, and support for those affected by the virus. Coming up, we'll talk with Nicole Roebuck, Executive Director of AIDS Atlanta Incorporated, and Jeff Cheek, Director of Fulton County's Department for HIV Elimination, about the work they're doing to reduce the number of HIV and AIDS cases in Fulton County. Stay with us. Welcome back. HIV/AIDS is a sexually transmitted viral infection transmitted through homosexual and heterosexual practices. According to the latest statistics of the CDC, in 2021, 36,136 new cases of HIV were diagnosed among people 13 years of age and older. The highest percentage of cases, 71%, were reported among gay and bisexual men, followed by 22% among individuals who engage in heterosexual contact and 7% amongst those who injected drugs. Today, we are joined by two individuals on the front line who are working to stem the tide of this ongoing epidemic. Joining the conversation is Jeff Cheek, Director of Fulton County's Department for HIV Elimination, and Nicole Roebuck, Executive Director of AIDS Atlanta. Thank you for joining me. You doing all right today?
Doing well.
Wonderful, wonderful. Jeff, well, you know I'm one of your biggest advocates.
Thank you,
All
Commissioner.
the work that you've done, especially with the fact that in my district is a large, I would call segment of cases. Talk to our constituents about the work that you all are doing to stem the tide in Fulton County.
Sure. Well, my pleasure, and thank you for having me here today. Fulton County has been a leader in the battle against HIV since the beginning of the disease. But in the early 1990s, Fulton County started receiving federal funding to provide care and treatment to people living with HIV. And that program serves a 20-county area. So not just Fulton, but all of our neighbors as well. And the purpose of the program is to provide care and treatment to people who are living with HIV. A few years ago, the Board of Commissioners determined that we needed to be a little stronger in what we were saying and created the Department for HIV Elimination to sort of set that goal of we're not here just to take care of, we are here to end HIV. And so Fulton has been a leader on that, and we thank you for all you've done.
I appreciate the work that you all have been doing, because watching it so closely, I know it's more about prevention, it's more about elimination. We still know that there's a stigma, but what would you just, if you were to say what was the progress that you all think or feel like you've made in this short amount of time, what would you say it would be?
Well, I've been involved in this since the 80s. And at the time when we first started these programs, it was really what can we do to help someone for the few years left that they're going to be living. And over time, medications have gotten better, programs have gotten better. And we're actually looking now at how do we make sure that we've got services for someone who's been living with HIV for 40 years? What do we do with someone who is aging and has HIV? And what do we do with the complications of people who also have diabetes or high blood pressure or any of those things that typically we didn't have to worry about? So it's been a beautiful thing that we're starting to address.
Well, do me a favor, here at Mighty Six Conversations, we're about empowerment and education. Let our viewers know what's the difference between HIV and AIDS.
Sure. So HIV is a virus, and it it affects your health.
Okay.
And after you've had HIV for a certain amount of time, if it's untreated, it becomes AIDS. And so AIDS is the final stage of HIV. Now, once someone has AIDS, you can start them on medications and they can drop back down again and be healthier again. And so it's not like it used to be where AIDS was a death sentence. Mm-hmm. Now it's just simply a part of the continuum of where someone is.
So let me ask you, what are some of the challenges you see, especially in communities of color?
Sure. Well, our program seeks to serve those people that have no other source. So we are for people who are low income, people who don't have insurance, people who don't have another way of getting services. And so one of the things we learned early on is that HIV is just one thing that communities are facing. That if they don't have housing, it doesn't matter if we provide HIV services. If they don't have transportation to get to a clinic, it doesn't matter. So we've started looking at the whole self and the social determinants, those things that keep people from getting into care. Across the United States, and especially here in the South, HIV has impacted people of color more than any other. Mm-hmm. Our epidemic here in Metro Atlanta is roughly 80% African American, which is a much higher percentage than what African Americans represent in Metro Atlanta. So the impact has been great.
So Jeff, listen, I'm one of your biggest fans and advocates, but did you just say 80%?
That's right.
Wow.
Yeah.
And so what's amazing to me, first of all, I thank you because I know how passionate you are about it, and also the holistic approach. Mm-hmm. I've heard you speak, and when you talk about the housing issue, mm-hmm. the social determinants, the things that affect individuals with mm-hmm. HIV and AIDS that are in our control when it comes to government. And so we know the progress that mm-hmm. you have made, but just let our constituents know, or maybe even some of our legislators know, what more can we do?
I think one of the things that we can all do is to be compassionate.
Yeah.
And to understand that people are going through a struggle and to be there for them. But I think one of the things that we need to make sure our elected officials in Washington and at the state know that this epidemic is still here. And this epidemic is not going away unless we do something to stop it. The way we stop it is to get people into care and get them started on medications. Those medications can help someone who is living with HIV be healthier, but it also can stop the spread of HIV. So we actually have a chance of actually ending the HIV epidemic if we are all committed to it and doing everything we can to make sure people are able to access those medications.
So I guess in a nutshell, what I'm thinking about is we really need to do more education.
Yes.
And also we need to deal with the stigma. Now with AIDS Atlanta, what are some of the things, what are some of the challenges, I would say, that you would say that you all have had here in Fulton County?
Yes, and thank you for having me, Commissioner.
You're welcome.
AIDS Atlanta has been around for 41 years, so the HIV/AIDS epidemic has been around as well for 41 years. So we've been in the trenches for the last 41 years. Our goal, honestly, is to go out of business. That should be our goal, is to go out of business so that we are no longer dealing with HIV. And that's twofold. Ensuring that we prevent people from getting HIV, and then for those living with HIV, hopefully, ideally, the goal is a cure. So in terms of challenges, many of the challenges have to go back to those social determinants of healthcare. There are many disparities, particularly in the South. A lot of the other areas across the nation are doing well. The North, the West, they've seen huge decreases in terms of their HIV incidence. The South continues to struggle. Fulton County, as Jeff talked about, is the #1 county with HIV cases, primarily Black and brown people. So in terms of challenges, we have healthcare access challenges. We have issues like housing, socioeconomic issues, poverty, stigma, racism, all of those things that contribute to the infrastructure that is supposed to be in place to support everybody, but somehow doesn't always hit the mark 100%.
So what I'm hearing from you is maybe better collaboration among those stakeholders, I would
Yes.
think. First of all, let me say that you all are doing a great job. And I would love to put you out of business. I really would. But I would be remiss if I didn't tell you that I sit in awe because I oftentimes hear you all speak. I see and hear the things that you all are doing. But I think sometimes, and here again, this is me in my own personal opinion, you cannot look at someone and tell if they
That's right.
exactly have the virus. And so I think a lot of times people just kind of get silent or they kind of say, oh, well, they're okay.
Yes.
Or, oh, it's somebody else's problem. So I know the county receives federal HIV funding, and it's administered by the Department of HIV Elimination. Can you speak on the Ryan White program?
Sure. So the Ryan White program was designed to help the communities across the United States that had the largest number of people with HIV. And it was emergency response. Basically, local areas could not handle the cost of providing care to everyone who needed it and would go bankrupt. So the federal government needed to step in.
Okay.
And so we first started receiving funds the first year in 1991. And the whole goal of it was to fund organizations like Aid Atlanta who are on the forefront and providing those services to people and developing a network of service providers. And one of the ways we do that is through through Fulton County's Ryan White Planning Council, or the Metropolitan Atlanta HIV Health Services Planning Council. That is one of the best ways people can get involved in making sure that their voices are heard and that they're making a difference in this. And the reason I say that is, unlike most community groups, this isn't just advisory. They actually say, we have looked at the needs of people in our community. And because of what we've heard, you need to spend this much of this money on medications, this much on transportation, this much on food.
Okay.
And then we go and we find organizations like Aid Atlanta to provide those services. But we're doing what the community has told us is what they need.
Well, do me a favor, just a quick segment. I believe in educating people. I know who Ryan White is,
Sure.
but could you kind of give our viewers
Sure.
a quick?
Right. So Ryan was a young man who was living with HIV that he got through hemophilia. He had a blood disorder.
Okay.
And he was one of the first people who started speaking out about HIV.
Okay.
And he was going to school in Indiana,
Okay.
and they threw him out of school
Okay.
because classmates were afraid to sit next to him.
Exactly.
They were afraid that if they touched his pencil, they would get AIDS.
Exactly.
You know, and this was a long time ago. We've come a long way since then, but unfortunately, Ryan did not survive that.
Exactly.
And so when the federal government was looking at creating an emergency program, it was right after Ryan had come and met with members of Congress. And so he passed away about the time that they were passing the legislation. So they named it in honor of him.
And I remember his story, and I often said to myself, I wonder, was it the actual disease or was it the stigma?
Right.
Because he was very courageous.
Yes.
And I think he did more in his lifetime than all of us probably could have done, because he had to do it not feeling well, but he was such a strong advocate.
Absolutely.
Let me ask this question. At one point, the largest group, newly infected group, was women of color. Has that changed any?
Actually, it's black gay men that,
Okay.
in terms of incidents.
Okay.
Women of color, we've been seeing over the last few years making some serious improvements.
Really?
Yes.
I'm glad to know that.
Yes, definitely. Now, proportionately to white women, it is off the charts.
Really?
Or disproportionately off the charts. So more black women, proportionately are infected with HIV than white women. And so they too are at risk. I would put black gay men as number one. Number two, trans women. Number 3, black women.
Let me ask you this, since you kind of, I want you to help me paint a picture.
Yes.
I'm always about empowering and giving information. If I were to say to a constituent, for every one white woman, how many approximately women of color would you say?
If I recall correctly, and we could go back and look at those stats, but I believe it's about 14.
Wow.
Yeah, it's huge.
14 to 1.
Yes, it's a huge differential.
Wow.
It might be more than that.
It could be more, but the fact that you said 14 kind of put a chill on me. What initiatives are in place to not only ensure that people are getting the access to the HIV and AIDS prevention, but what things, especially at the county level, that either we're doing or need to do for the underserved communities?
So Fulton County is doing a lot.
Okay.
I wanted to mention one statistic while we were talking
Go
about
ahead.
this. When we look at the impact among African Americans, for a black gay man in the state of Georgia, there's a 1 in 51. Well, actually, let me back up. For anyone in the state of Georgia, there's a 1 in 51 chance of getting HIV in your lifetime. For a black gay man, it's 1 out of 3 chance of getting HIV.
Could you
in
say that
your
again,
lifetime.
please?
That a gay black man has a 1 in 3 chance of acquiring HIV in his
Versus
lifetime.
1 in 50.
Versus 1 in 50 for the general.
Wow. So we definitely need to do more.
Right.
We do.
We definitely need to do more. So what? And I know that we're doing a great job. I know you all are doing a great job. But what more needs to be done? I'm hearing the
Right.
education part, the holistic part.
Right.
But what more? What areas would you say, if you had a moment in time to tell me this is an area we really do need to work in?
Right.
What would you say it is?
I would say we need to bring our services to the people.
Okay.
That it doesn't work for us just to build an HIV clinic and say, you come to us.
Got you.
And it also doesn't work if you put HIV clinic at the top
Got
of
you.
it. You know, that feeds into the stigma.
Got
So what
you.
we need to do is look at local health departments that are providing vaccinations or high blood pressure treatment or any of those services. So you might be there for one of those or for HIV, and no one would know why you were there.
You know, it makes me think about normalizing healthcare.
Exactly.
Yes.
That's what we need to do. We need
Yes.
compassionate, and we need peer support in normalizing healthcare to help with the stigma. There's more to come on Mighty Six Conversations. Coming up, we'll discuss ways you can support a family member, colleague, or friend diagnosed with HIV or AIDS. And we'll discuss ways to help patients transcend stigma and embrace hope. Stay with us. Welcome back to Mighty Six Conversations. We're continuing our discussion today on HIV/AIDS with Fulton County's Department for HIV Elimination, Jeff Cheek and Nicole Roebuck. We had a lively conversation going on here, and I want us to speak about our senior community, because we have a lot of stigma, or we have a misunderstanding. And I think, Jeff, you and I talked about it.
Yes.
People don't envision the seniors having a sex life.
Right.
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 Can you speak to that a little bit for me?
And I think that's one of the things that we need to do to break down people's perceptions of who has HIV. You know, that it is not someone that looks like me necessarily. That it is anyone and everyone. But we've talked a lot about seniors in HIV, talking about people who are living longer and becoming seniors. But I think the thing we don't talk about enough is people who are seniors who are acquiring HIV
Exactly.
in their later years.
Absolutely.
Exactly.
And so I think we need to do a better job within our senior centers of making sure that information is shared, to make sure that people know what they can do to keep themselves healthy, what they can do to access services if they need it, or what they can do to have an agency like Aid Atlanta come in and provide an educational seminar or a series of seminars.
Exactly.
They have a program that reaches out to women.
Yes.
And typically it's women with HIV who are seniors. It is seniors that are, it is women instead of men who are seniors with
I got
HIV.
you, I got
said
you.
the words wrong. But they have a great women's outreach program that
I
focuses
think
on
I
those
think
things.
that's what we need, because in the senior community, there's a lot of advocacy, but there's also a lot of times seniors will come and have a conversation with me candidly, and some of those conversations does cover this topic.
Right.
Absolutely.
And so as we're sitting here talking about what we can do with prevention and other things, we should have a conversation about how do we let the seniors know, we know you have a sexual life,
Right.
sexual activity,
Right.
but protect yourself
Absolutely.
and do what you need to do. So I think it would behoove us to try to move into 2024 putting a little bit more emphasis on that. I'd be more than happy to collaborate with you all.
And one of the other challenges, people of a certain age don't believe they're going to get pregnant, so they're not using condoms or any other thing.
You know,
And so we need
you
to
know
let them
what,
know there's
Jeff?
still a need for condoms.
You and what's funny about that, Jeff, that you say that, I've heard that.
Yeah.
And the fact that you vocalized it lets me know it is actually true, because
it is
I've
real.
heard it more than once
Right.
in a couple of our senior centers.
Yeah.
And so I think this is good. We should have more of this, but let's kind of integrate some of our seniors in it. I think they'll be more than happy. Nicole, how can individuals support friends or family members who may be living with HIV or AIDS?
I think that's a great question, but it's almost a simple response. You know, treat everybody, treat your family, treat your loved ones like you would. It doesn't matter if they have HIV and AIDS or not. Treat them with the same respect and dignity and caring and understanding. You talked about stigma earlier, and stigma actually kills. And so if families cannot perpetuate that stigma, let people know that they love them, they care for them. How can I help you? Do you need a ride to your, medical appointments? Just create safe spaces for their loved ones that might be living with HIV and AIDS. It is a disease that people can live and thrive with, It is not something that should be a death sentence. But sometimes, like I said, stigma kills. HIV stigma can kill because people become isolated and depressed, and depression can harm T cells. Stress kills.
Exactly.
So let's be loving, let's be understanding, let's care for the people that we've been pleased to care for.
So it sounds to me that a prescription that is free is love
Yes.
and compassion.
Yes.
If we could do more of that, it probably would do way more than any medication.
Absolutely right.
Thank you for that. Well, I appreciate you all for being here today. Thank you for the work that you're doing collectively and independently. We appreciate you here at the Mighty Six. And did you all have any closing words that you'd like to share with our constituents?
Well, wanted to thank you for your leadership and for bringing this message to the community and every day helping to make Fulton County better. So thank you for letting us be a part of that.
Well, I'm honored. I'm honored for you being here, and I want you back. So I'll let you know. We're going to collaborate on 2024 and
Sounds
make
good.
sure we do something about ending the tide of HIV and AIDS in Georgia, not just Fulton County. That ends this edition of Mighty Six Conversations. I'm Commissioner Khadijah, guardian of your trust, and one who appreciates the opportunity to serve in making sure that Fulton County government is working to meet your needs and concerns. Want to get in touch with our office? Connect with us online. Email me at khadijah.abdur-rahman@fultoncountyga.gov or visit us at commissionerkhadijah.com. Like us on Facebook or follow us on Twitter. And of course, you can always contact me at 404-612-8222. Until next time, stay safe and know that I and the Mighty Six team are working for you. Take care.